Dr. Charisse Cobbs. Pregnancy and dental care. You know, this is the most exciting time in a woman's life, is to be expecting a child. And you know, oftentimes they're so busy seeing the obstetrician, getting with a pediatrician, and sometimes even a nutritionist. But we need to have them add the dentist to that list also, because it's very important to take care of your oral health care during pregnancy. Women don't realize that there's quite a few hormonal changes that are occurring during pregnancy. You get bleeding gums. These hormonal changes can also increase the mom's risk for periodontal disease, and which can also give you problems with the development of the baby. So these are things that we want to avoid. You know, we're so conscious of our health, especially, you know, when a woman's pregnant. You want to eat right, you want to do all these things. Adding the dentist to the list of things to do while I'm pregnant should be one of them. Taking care of the gums is very important during pregnancy. So there are different things that can be done before, during, and after. So here are a few tips for the mom. Before pregnancy, especially if it's a planned pregnancy. You know, women are getting older these days, they're planning, but we do understand accidents do happen too. So for a planned pregnancy, I highly recommend that you have an appointment with your dentist prior to becoming pregnant. Have a complete oral exam with inclusion of x-rays, a periodontal exam. This way the dentist can find out in advance if there's going to be problems, because you can take care of them. You can take care of these problems ahead of time. It could, you know, if there's a problem with gum disease. You know, many people have gum disease. 70% of the population have gum disease and aren't aware of it. There may be some oral infections that are going on. There could be abscesses that are going on. That can definitely harm the baby, and believe it or not, it can harm the baby's developing teeth, because it has been shown that tooth decay can be passed on from the mother to the baby. So it's very important to take care of these problems prior to. During pregnancy, we recommend not doing elective dental procedures, let's say fillings, things of that nature, in the first trimester and the latter half of the third trimester. The baby is developing a lot during the first trimester, so we want to avoid having to put the mom through any stress, and we don't want to interfere with any development of the fetus. And in the last half of the pregnancy, the third trimester, the mom's big, the baby's grown, you know, and what we have to be careful of is, because when you're in a dental office, you're laying back in the dental chair. Well, the uterus at that point is positioned well over the vein that runs to the lower extremities that brings blood back to the heart. And if the mom is laying back for any long periods of time, it can collapse those veins and cause the mom to faint. So we recommend, if possible, not to do treatments during that part of pregnancy. But if sometimes, you know, emergencies do occur. Emergencies happen and it can't be avoided and treatment is necessary. If that is the case, then we recommend changing positions every, 3 to 7 minutes, just to give mom a chance to relieve the pressure that's on that vein. Highly recommend getting the teeth cleaned during this time, because as I stated before, there are hormonal changes that are going on. The gums get tender. Even in our office, our hygienist is pregnant. And so, she's taking extra care of her gums. And I remember her telling me last week, "Oh, Dr. Cobbs, even my gums are tender." So it's just a part of nature. And so, even my hygienist, is taking extra care of her gums. So you want to get them clean, get the bacteria out of there, try to keep them as healthy as possible. During pregnancy, I recommend that the mom eat a healthy diet. Pregnant women have a tendency to have sugar cravings. And as we know, sugary foods are not good for the teeth, because that's where we start to get decay. And if the mom is not, if we're not doing elective treatment during, a 6-month period, that's a lot of time for the decay to grow on the teeth. So we recommend that you eat a healthy diet and try to cut back on the sugary things. I've had 3 children, so I understand about those cravings, and it is really hard, but just a little note there, we highly recommend that you stay away from sugary foods. In the first trimester, oftentimes, the mom will have problems with morning sickness. And if you've been pregnant out there, ladies, and have had morning sickness, it is no fun. But here you have the acid on the teeth, which again can cause issues with the teeth and can cause some dental problems. So what I recommend for moms that are having problems with morning sickness is, number one, try a toothpaste that's bland. And your dentist or your hygienist can recommend a bland toothpaste for you. And rinsing with water, because that rinsing with water will really help get that increased saliva flow, and you're cleansing the mouth a little bit better, so it'll get that acid off the teeth. And once again, see your dentist during that time. After pregnancy, we recommend that you get back into your dentist, because if there were problems that arise during the pregnancy, now is the time to take care of them. You've delivered the baby, your hormones are trying to come back to normal. You still may have a little bleeding in the gums. There may have been some problems with some periodontal disease, may have started to develop. So we recommend that you come back into the office, have another complete exam and x-rays to see if there's been any changes, and get back on a regular treatment plan, your regular visits with the dentist.